Douglas is essential and a key component to helping our communities engage in healthy activities for positive growth within the community. So today we're going to hear from 3 community healthcare partners that continue to help shape the narrative and landscape of health in Douglas County. Please join me in welcoming to the stage Dr. Janet Memark from Cobb Public Douglas Health, also one of today's sponsors, Dr. Debbie Dalton from WellStart Douglas Hospital, and our very own Dr. Lakeisha Davidson from Kaiser Permanente. Ladies, would you please? All right, ladies, I'm going to allow Dr. Memark, if you'll start, and we'll just go down the line, and then I'll be back up with a few questions and engagement from our audience. All right? Take it away. Oh, you didn't have a mic. Oh, okay. All right.
Okay. All right. Thanks everybody for having us today. We're very excited to be here, and as a sponsor, it's critically important that we're able to work with the business community, and we appreciate that so much. I think the last 2 years have really taught us that, it really takes a village, and you are a big part of that village that helped us to do everything as safely and in the best way that we could. So I do want to recognize we do have some of our board members here for our Douglas Board of Health, as well as our community foundation, and some of our staff who make everything run the way they should. All right, so great. So I'm going to talk briefly. For those of you who don't wait with bated breath for our community health assessment to come out every few years, this is something that we work on every 5 years. And what we ask during this assessment, where we go through the community and really try to dig deep into the health issues of the community. We want to know how healthy our residents are. What assets and resources do we have that can improve the community's health as a whole? And we use some of the 10 essential public health services and take a look at those provided to the community. But we also look at different things that could be affecting the community's health or just in general the situation in the community. So in 2016, when we last did our assessment, the focuses that we had were on access to health services. We found that we had some holes in access to primary care, as well as chronic disease management and behavioral health. And we also looked at some lifestyle things as well. So I'm going to show you when we get to our leading causes of death how lifestyle plays into that. And then, unfortunately, you're going to see that 5 years later, we still have some of the same problems that we had back then, and some are actually worsened due to the pandemic. But we did make a lot of great progress, and we made progress with a lot of our partners. So Georgia Greystone Power is here that helps us, and with our community leaders, and also with the pantry, and working together to really make changes, because it doesn't happen just by one group. All right, so these are things that we focused on, and what we found were some important areas that could be worked on in 2021 to 2022. Access to care continues to be an issue, and so it's one of our number one issues that needs to be continued to be worked on, as well as healthy living. Behavioral health, unfortunately, we are seeing that behavioral health has worsened, and it's probably due to the pandemic situations. But we also have a focus on maternal and infant health as well. And housing, because of the pandemic and also with our current financial and economic situations, that also has become more of an issue. And then I'm going to touch upon COVID-19 and emerging threats, and please don't leave the room. I will do it briefly and just tell you what we have on the horizon. All right. When we looked at access to care, we continue to have issues, and you take a look in our primary care areas as well as our dental areas, as well as mental health, you can see that we still don't have enough doctors to treat the folks that we have in the county. So you look at that the red line is Douglas County, and then you'll see the yellow is Georgia, and blue is United States. So we still need more primary care providers. Dentists is a little bit better, but look at mental health. Mental health is continuing to be an issue, and we see this, unfortunately, nationwide. We see, exacerbations in mental health. But, primary care, I think Dr. Dalton will tell us a little bit about the urgent care that's also opened, and they're getting some medical residents coming. As some of the good fallout for us from AMC's closure is that we're going to get some more trainees coming, and that will provide more services to the community. So we're grateful about that. So when we look at providers, affordability, transportation, healthcare access, so you can see that we still have about 13% of our residents that are uninsured. And that is, when you look, it's probably around what we see for the nation, but Hispanic residents continue to be a problem in Georgia for not having insurance. And so both Georgia and Douglas County are higher than the United States when we look at Hispanic residents. So here are our ranked causes of death rate in Douglas County, and this is by age. So when you look at this, you can see number one is ischemic heart and vascular disease, so your heart and other large arteries. Number two is cerebrovascular disease, and so that is mostly strokes. Now, when you look at these lines, so you see on the first one how the arrow is kind of in the green. So it's actually a little bit better than where Georgia is. But when you look at strokes, look how far over and to the right it is for strokes, so way worse. And I'm not exactly sure, I don't know if it's access or what it is, but that one definitely is more of an issue. But you see, we are doing better than Georgia in a lot of these different categories, and there are just a few, like accidental poisonings and exposure to noxious substances, and of course, unfortunately, opioid overdoses are included in that. And then we see mental health areas as well. So, but kind of the good thing, so we already talked about having an access issue, but when you look at a lot of these conditions, a lot of them are controlled by healthy living habits, right? But also access to care. So if we can get our blood pressure down, cholesterol taken care of, and have access, then maybe we can bring some of these down. For emergency room, it's a little bit different. So these are kind of more the traditional things that you would see for emergency rooms, but some of them are things that maybe a primary care provider could be able to handle, right? So it stands to reason that if we get more access, that we will be able to help with these a little bit better. So, oopsie, sorry. This thing went fast. Okay, so healthy living. We talked about the reasons that people were dying. We had heart disease and stroke and hypertension. So, but when we look at the population, we see that 36.7% of the population is overweight. 30% is obese. When you add those together, we're at 66.7% that are either overweight or obese. And so these are things that are, reversible changes that can affect some of the reasons that we are needing to have access. So this is also another nationwide problem, and I'm sure worsened by the pandemic, if I look at myself and everybody else. But healthy eating as well. 50% of residents in Douglas County say that they live more than a mile away from a grocery store. So that makes it a little bit difficult to get healthy choices. And so people do feel like they need to go outside the county at times to be able to get healthy options. Behavioral health, we're going to, unfortunately, I won't touch on this too much, but, we will definitely, a lot of you may know, are seeing a lot more problems with this. And a lot of it is thought to be from the pandemic and the social isolation and just increased fear and uncertainty that people are having. when I was looking at the data that we were seeing, I was a little bit shocked by one piece that I actually sent to Superintendent North, that it was young girls that were actually, the amount of girls that were attempting suicide was very high. And that was something that was very shocking to me, and I sent it over to him. It's something that they may want to think about to try to do some interventions with, because I was very shocked by that. But folks that are having actual higher rates of death and injury due to mental health problems are people that are classified as white, multiracial, and male residents. Although what we saw was female adolescents were more likely to attempt, males are more likely to actually succeed. Maternal and infant health is something that we focus a lot on at Cobb and Douglas Public Health. And so what we did was we have found when we were looking at some of our health data, we were finding that we had some disparities, and many of you have heard about this, that the number of black women that had children who suffered from premature infant death and maternal death was much higher in black women than white women. And when we looked at our data in Douglas County, what we found was this was in the Douglasville area that we had the highest concentration. So we had applied about 5 years ago for a HRSA grant to address these issues, and we won that grant, and we're actually reapplying at this time. But what we were seeing was that, there were over 10% of women that were getting late to no prenatal care. And then 8.5% of births that actually were getting less than 10 visits, prenatal care visits. And when I looked at the math that you do, it's at least 10 visits that a woman should have in a healthy pregnancy. And so, once again, it was some access to care issues that, focus groups said that OB and pediatric options were limited. It was hard for them to find care. And this touches upon what we had talked about was the infant mortality rate for whites is 4.8 to 1,000 live births, but it was 8.3 in black women. So we've been focusing a lot on trying to get these ladies care. Housing is another issue that we're seeing. We're seeing soaring high housing costs, right, over the last few years. And what we found is that 47.5% of renters actually spent more than 30% of their income on mortgage. And you should be less than 30%. And so we have a lot of folks that we're spending a lot on that. And having to, if you need to work a full-time job at minimum wage, we know that minimum wage is not a living wage, right? But to be able to afford a house, you had to work 3.4 full-time jobs. So we know that COVID affected a lot of things. I'm just going to jump over this really quickly, but we know that we have it's unstabilized a lot of things that we had going on in the nation. But we have some good news with vaccinations. At least we got vaccinations going. So over half the population received over one dose. And this is the only PSA I will do is that we have the new bivalent booster that is out, and there's a lot of confusion over that. This is the new booster that actually targets the variants, the new variants that are out. We have a couple of variants that may be coming our way, and so everybody is eligible to get a bivalent booster. So please, if you can, get that. It's different from the old boosters. This is a new one that just came out. And so when we look at our stats, we had almost 41,000 residents that had tested positive for COVID, and this is a huge undercount because does not include the home test, and most people are doing home tests now. And so, you can see the spikes at the bottom that we all suffered through, and this last one was kind of prolonged, but it wasn't as deadly as the ones that we had seen previously. So we have some immunity, but you have to keep getting vaccinated to make sure that you keep that up. Monkeypox, I know some of you have heard about monkeypox, and I think we're on the tail end of that, but in our district, these are the numbers that we saw for monkeypox, so about 176 cases, and 168 of those were male. And you can see the age range, and 142 out of the 176 were black males, and the majority were HIV positive. And so it was, kind of a tough start to that, but I think it was a very successful campaign to get folks vaccinated for monkeypox. And it has really come down a whole lot, so we're hoping it doesn't get into the general population and continues to be managed. All right, the last thing I'm just going to leave you with is flu. It's flu season. And so when you look at this map, there's nothing that we don't have going on in public health. You can see that Georgia is one of the only 3 states in the dark red there. We have a very, very high flu season happening right now. So I give you one guess as to what you should do. Get your flu shot. So last year, this time, we only had 3 hospitalizations for flu. This year, we have 35 hospitalizations already, and we just started. So it is more than 10 times as bad. So please get your flu shot. It's very important because I'm sure Dr. Dalton and Kaiser will say that they do not want to see you get admitted for the flu this year. And with that, thank you very much and for giving the time to give you all our information today.
Good afternoon, everybody. Thanks for the opportunity to come and speak to you from Wellstar. So I'm Debbie Dalton, and I'm the Chief Medical Officer at Wellstar Douglas Hospital. So I'm going to just kind of give you a little bit of overview of what's going on at the hospital. Right now, we only have 3 positive COVID patients in our hospital, which is great. There are many times that we cannot say that, and there are actually sometimes we had 0 patients in our hospital, which was fabulous too. We celebrated those days, but it's not gone completely, of course, but it's still out there. We only have 1 person in the ICU who has COVID, so that's a big plus too, because we used to have our ICU completely full and overfull of COVID patients. So we're continuing to take care of those patients as we need. Our volumes at the hospital have perked up quite a bit lately. So we are a 108-bed hospital. We have 111 patients. As of this morning, we had 111 patients in the hospital. Now, what do we do with those patients when we don't have beds? We keep them in the ED. Not ideal, of course, but at least they have the nurse there and the doctor there, and they can get taken care of until we can, accentuate with some discharges and get people out of the hospital and then move them up to a regular bed. So if you ever hear people say that they kept me in the ED, we only keep you there because we have no beds upstairs in the regular wards, but we will get you up there as soon as possible. So just be aware that right now it's a little bit of a busy time. As Dr. Memark mentioned, we are seeing quite a bit of flu. A lot of our lab values, and I also look at the children's healthcare values, and it's mostly flu, and then a lot of RSV, and then COVID in the kids as well too. So that's what's out there in the community. So just so that you're aware of what everybody's passing around. There's also enterovirus and rhinovirus, all these other typical cold type of viruses. They usually don't cause any admissions, but the other 3, the COVID, the flu, and the RSV, especially in kids, is usually a big deal for them. I know Dr. Memark mentioned about AMC closure, and I don't want to, it's a very sad situation for AMC and that community, but it is a great thing for our community, so I'm going to talk a little bit about that. So with the closure, we have gotten a family medicine residency program that's coming to our hospital. So that is 18 residents, 7 faculty members, those are attendings who are family medicine physicians and board certified, and 3 part-time faculty members as well who are going to be coming to our hospital very soon. Actually, some of them started today. The residents who are rotating through the emergency department are starting today, but we're going to have them rotate through surgery and OBGYN, and they will deliver babies too in the community, so we're hoping that that will add to our program that we already have, and we're really excited about having them. They're in Douglas County, as Dr. Memark mentioned, we don't have enough primary care physicians, so a lot of people show up in our emergency departments without having a primary care physician that they can follow up with. So with this, we're going to have a clinic, and so the faculty and the residents will be running a clinic, and they'll have follow-up after they get discharged from the hospital. So they no longer go home and don't have somebody to follow up with, and they can't get their medications, and when they reach certain barriers, we can help them with that as well too. So I think it's going to be a great thing for our community. And 85 of the team members who worked at AMC, nurses, respiratory therapists, technicians, all those people, we're getting 85 new team members that are joining Douglas as well. So we had quite a shortage of nurses, like all the other facilities in the state and I think the whole country. But for us, that is phenomenal to be able to add more nurses and more technicians and respiratory therapists and everybody else. It's going to be, it makes it so much easier. And when we talk about burnout, so many people getting burned out because there wasn't enough staff to help take care of the patients. And they did take care of the patients, but it's so nice to have that extra boost of other team members who will be helpful in taking care of patients. You get to do a little bit less work, but you get to pay attention to your patients a little bit better as well, too. So I'm hoping that we'll be able to get back to where we were pre-COVID. And it's been a long, long road. Another really wonderful thing that we added to our community recently, within the last year, was our pediatric ED, which I know is really, really needed in our community. I'm a pediatric emergency physician, and I've worked at Cobb and Kennestone and Paulding, and I would see patients from Douglas County, and I'd always ask them, well, why don't you go to Douglas Hospital? And they were like, well, and they were right. It wasn't very, very pediatric friendly, but this new pediatric center, if you've not had a chance to see it, please come by and just peek in the window at least, or you can contact me, and I could be happy to show you and give you a tour. But it's 10 rooms that is all pediatric friendly, and it's a great little unit for the kids and adolescents as well too. So we take care of all the teenagers there as well. And we have a new urgent care center that just opened within the last month, late September. So that also will help unload some of the patients in the emergency department, because many of our visits are urgent care type visits, not really emergency visits. So this will help us as well. So if you ever need anything for urgent care, please feel free to visit our urgent care. It's directly across the street from our emergency department. And then above the urgent care center, it's a building, if you're familiar with that area, has 2 floors. The downstairs is the urgent care. Right above it, we're going to have our own GI and orthopedics practices as well. So those are, I think orthopedics has just opened, I think this week, and GI, gastroenterology, will be opening early next year. So very excited about adding those services. And just also, we just had the Joint Commission come through, and then for those of you who are not familiar with the Joint Commission, they are a national group who comes and accredits hospitals, and we are up for our triennial survey. So any day now, they usually do a surprise visit. They come for 3 days and spend some time in our hospital and review certain things and make sure that we're doing all the right things for our patients. So, but on Monday, they came for our total joint program. So the total joints are the knee replacements, the hip replacements, and they came and surveyed us, and they accredited us for that as well too. So they feel we're doing a really good job with taking care of those orthopedic issues and the total knees and total joints. So very excited about that. With that, I will go ahead and pass off the baton, and we'll have some questions, I'm sure, later, so I'll be happy to answer those for you later too. Thank you.
Good afternoon, everyone. My name is Lakeisha Davison, and I'm a pediatrician at Kaiser Permanente of Georgia. I work in the Snellville office primarily, and I want to just first thank you for having me here. This is my first community impact luncheon, and so I'm really excited to be here to talk with you. I'm going to be speaking in my capacity as the co-lead for equity, inclusion, and diversity. So we're going to be, of course, those affect healthcare, but I'm not going to be talking about patient-specific things, just sort of things we can do and how Kaiser Permanente is looking at how we can affect the health of our communities. And so before I do that, just want to show let you guys get to know me just a teeny tiny bit more. So this is just some pictures of us. Like I said, I'm a pediatrician. My dad was in the Navy, and so I'm a Navy brat. We lived all around the country as well. I lived in Japan for a few years. And then he he retired in Jacksonville. So I went to school in North Florida and then came up here to Emory for medical school. I'm a runner, and that's my husband up there. We bike together as well. And then this is my brother here. And so yeah, I think that part of community and sort of relationships are really important for people to work together to solve problems. So I just wanted you guys to know me a little bit more as we travel together down this road. Maybe I can get to the next part. All right, so talking about Kaiser Permanente's EID framework. So again, the EID stands for Equity, Inclusion, and Diversity. You guys have probably heard those terms a lot. I just want to dig into them a little bit more here today. And so, we think about this on 3 sort of axes or pillars. And so you have care delivery, which of course is, the care that we give to the patients. What are we doing looking at health disparities? How are we making sure that we're improving access for our patients, regardless of where they come from, what they look like, what language they speak, what religion they practice? And then we talk about the workplace, which is, where we work. So where the physicians, nurses, all clinicians, administrative staff, everyone who works together in a hospital system is part of the workforce. And how do we make sure that when you come to work, you feel like you can show up as your true self, your authentic self, your best self, your self that brings diversity of thought and brings a different perspective to the work that we're doing together. And so those are two, and then, of course, community. So how do we show up for the communities that we are serving? It doesn't make sense to be a healthcare system that doesn't actually listen to your community members and provide the services that they need. So if you show up somewhere and just do what you think is best without taking into account what the community is telling you, then you're not going to get outcomes that are good. And so we want to look at all of those three pillars. At least that's how Kaiser Permanente thinks about delivering care in an equitable manner. And so I just want to talk a little bit about implicit bias. You guys have, I'm sure, heard about this a lot. Basically, bias is not bad in and of itself. We all have bias. Bias is what makes us be able to make decisions quickly. The problem is many of us, we all have one experience and then overgeneralize that to mean that is exemplary of every single experience like that. For instance, if you have a bad traffic day on 285, then you just think that 285 is bad, and that's not necessarily true. It can be at times, but that is not necessarily true. And so, it's just how our brains make snap decisions. Otherwise, we would be paralyzed by having to make so many decisions all the time. The problem is when you have you take these biases and apply them without recognizing that's what you're doing. So it may be that you have had an experience with an older person who wasn't familiar with how to use the internet. And so you just assume now that everyone who is not a millennial doesn't know how to use the internet. And of course that means that you are shoeboxing or shoehorning a lot of people, and it's going to affect the way that you talk to older people, and it's going to mean that you are making people feel bad when it's unnecessary. You want to, and so that's just an example. We talk about race as one thing that we look at all the time when we're talking about implicit bias, especially in the last 2 years. But that is not the only thing. So it can be race. People have biases against certain genders. People have biases against your sexuality, your religion, the language that you speak. And so I would just want you all to recognize that we all have bias, and having bias in and of itself doesn't mean that you are a bad person or that you are inherently adversarial, xenophobic, racist, whatever term you want to use. It just means that we have to recognize that there are times that we have to look into ourselves to figure out what it is we are biased against, and then address those biases before they affect how we interact with our patients and our community members. So, sorry, that is one thing I'm super passionate about, so I just wanted to make sure you all know. And so, physicians, clinicians, we all come from the communities. We're not sort of picked from the sky. And so the biases that all people in our nation have then are brought into healthcare and then are affecting the care that we give. And so it's just important to point those things out so that we all know that we have work to do. And let me see if I can, all right. So this is another slide that I wanted to briefly talk about because equity is a term that is talked about a lot, and I think some people are unclear about what it means. So I think if you look at EID, equity, inclusion, diversity, people are pretty clear on what inclusion means. People are pretty clear on what diversity means, but what does equity actually mean? And so it is not exactly the same thing as equality. And so in these three pictures, you can sort of see three people who are the same height, who are wanting to get an apple. And in the real world, people start out at different places. So someone's going to have super easy access to the apple, others are going to have less access. And so if you are going to treat them all equally or with equality, then you are going to give them a box of the same height. Okay, and then that box is going to be helpful for some and less helpful for others. However, if you are going to treat folks with equity, then you give them what they need to get what they want or what they need to do their job. And so in this example, the person who was closest to the tree and on the highest ground gets a box of a certain size. The person who was a little bit further away and had that needed a little bit more height gets a slightly taller box, and then the third person gets a ladder. And so it wouldn't make sense to give everyone the same thing if you want them to all be able to get what they need to do their job. This is an easy example, but it can be, this happens throughout the workplace and throughout our communities as well. And so I hope it sort of illustrates for you that equity and equality are not the same thing, and that what we're striving for is health equity. So you give your patients what they need when they come in to make sure that they get the outcome that they deserve. Does that make sense to everyone? And that's really all I have for today. So this is my co-chair is Dr. Emil Panera, and then Rosanne Petrillo, and we are sort of the champions for equity, inclusion, diversity at Kaiser Permanente. And so if you ever want to reach out to us, you'll have these slides, you'll have access to them, I believe, so that you can reach out to us. We have some information on equity, inclusion, and diversity on our national website. And then also, if you're interested in finding out how your biases show up in your day-to-day work, you can take an implicit bias test. And so Harvard did a whole project on implicit bias, and it might be really enlightening for you all to do. You may find out that you have biases that you were unaware of. And like I said, it's not just race or ethnicity. It can be age, it can be gender. Like many of us, without knowing it, are a little bit ageist, and pretty much all of us, if we are a little bit ableist as well, unless we are differently abled. Most of us sort of assume that everyone can do the same things that we can and design things that are inherently disadvantageous for people who are differently abled. So just want you guys to be able to take that opportunity to learn a little bit about how you can show up for your patients, your colleagues, your coworkers, and all of the folks in the community that you all are trying to help. And with that, I'm going to go sit down, and then I know you guys will have questions for all of us. So thank you so much again for having me.
Thank you so very much, ladies. I've found that to be very, very informational, and the thing about statistics, they're true and they're disheartening, for sure. So let's all try to corral and champion for not only ourselves to be in a better place, mentally, physically, emotionally healthy, but our family members and as well as our children, because it's important for us to do the things we say we want to do as a community. We need to be healthy and we need to be together. So thank you so much, Dr. Denmark, Dr. Dalton, Dr. Davison, for being here today. And as a small token of appreciation, a contribution will be made in each of your names to the Chamber Board Scholarship, which funds scholarships for graduating high school seniors. So I'm going to ask a few questions, and then we'll open up, Kobe, wherever you are, if we have time for a question or two from the audience. But what can we do, this audience that's sitting here today? Some of them are business owners, entrepreneurs. Some of them work for large organizations that are housed in Douglas County. But what can we do collectively and individually to have better health in Douglas County? What can we do? Yes. Or just use her.
Hear me now?
Okay. The one thing I love about having you all here is that you were a lot of the major employers throughout the county, right? And so you have the parents of all of our folks and the major household, head of household. And so I think there's a lot that can be done. When I showed you the leading causes of death and the situations that we're seeing in Douglas County, a lot of that's reversible, right? And so at the workplace, that's a place that you all can start. And so, having healthy living habits with your staff, encouraging healthy eating, even some educational stuff, having non-smoking policies. I think all of these things are important. One of the things that we did at Cobb and Douglas, we have a physical fitness time for everybody. Everybody gets 30 minutes out of their day to go and do some sort of physical activity. And you don't have to take it, but if you take it, you'll be walking around, you can do an aerobics class, you can do something. And some people may think, oh, well, God, you're going to give them 30 minutes. First of all, people are wasting time anyway, right? So we know that. And so if I can dangle that 30 minutes in front of you, and we have a lot of folks that take advantage of it, and I love it because your staff is going to feel better, right? If they're out there, they're working out, and they're losing weight, or just even the endorphins of it, they're going to feel better. And they're going to make better employees for you. They're going to make better parents to the kids. So there's a lot that you all can do. So, and get your flu shot.
Yes. Yes. Anybody else?
I would just add that we kind of got in the habit of all these Teams and Zoom meetings, so you could take them on your phone and just walk. Just encourage them to just walk while they're talking. It doesn't have to be strenuous walking; just has to be walking, just to move around and get some circulation going.
And I think I can speak personally. Go to the doctor. Yeah. And I think sometimes we always think that we feel healthy, we look healthy. I don't need to go, but just for an annual checkup. But all the, I do have other body parts that need to be checked as well, right? So I think just knowing you have to go to the doctor and it's okay, even though, I think for sure, attending and listening to your body, listening to your doctor, and then more importantly, advocating for yourself. If you know something is wrong, you believe something is wrong, tell somebody and tell someone else, correct? All right, Dr. Dalton, what are the hours of the new urgent care?
They're from 8 in the morning until 7:30 at night. As the volumes get bigger, we will probably expand those hours, but right now that's where they're starting from, and so just so that you're all aware that as it gets busier, we'll probably be adding more providers and more hours.
Excellent. Dr. Davison, okay, what are, two brief ways we can identify our implicit biases? The self-reflection, what are ways that we can check ourselves?
You can take the Project Implicit test that I talked about in my presentation today. If you just Google implicit project or Project Implicit, it'll take you to the website, and then you can look across a variety of lenses and see where you're biased, because we all know that we have biases somewhere, so you can identify them. And then you can sort of get to work. When you find that you are biased or where you find your biases, figure out what you're going to do about that. Does that mean, you're going to read a book by someone different than who you would typically read a book by? Or does that mean that you are going to, support a business that is owned by someone outside of your typical demographic? There's many, many ways, but I think being reflective and figuring out where you're biased, and then being intentional to work on those biases, and being open to receiving feedback. If someone is kind enough to give you feedback that something that you said made them feel, the young kids are saying, some type of way. But if someone gives you the opportunity to learn more about their heritage, their religion, their walk through life, take that opportunity and run with it, and then and you'll learn a lot about yourself, and you'll learn a lot about what you can do to make somebody else's life much better, more rich.
Excellent, excellent. All right, ladies and gentlemen, we have time, Kobe said, for one or two questions. Who has an engaging question you'd like to ask our panel this afternoon? Don't everybody go at one time. No questions for our panel? Thank you.
Hi, I just have a question regarding Wellstar with all the growth. Is Wellstar planning to have an inpatient freestanding hospice care inside of Douglas County, like Cobb does?
We actually do have inpatient hospice, so what happens is if the patient is admitted to the hospital and that's what they require, then there's a process that we transfer them into. Not transferring it, they're transferring within our EMR into a hospice program. So the hospice nurses do come out and talk to the family and to and the patient if they're able to, and make some decisions for the family. So we do offer that. It's not as well utilized as it should be. I think people just don't know about it, but we do offer it.
Another question? All right, let's give our panel another round of applause and thank them for sharing. Yes. You could probably do that. Walk that way, I guess. Well, you know what? Okay, you're over here. Sorry.
No worries, no worries.
Yeah. All good. You're just getting in your, Dr. Dalton, your walk. That's all. That's all. All right, now we just have, if you be patient, we have some official business that we need to take care of that we do periodically. I'd like to officially call the annual meeting of the Douglas County Chamber of Commerce to order. Our only order of business is the confirmation of our 2023 officers and board members that will be reflected on our screen. Okay, they'll be reflected shortly. The nominating committee sent in its recommendations that our chamber investors for petition none were received, and with no petitions to the contrary, the chamber board has accepted these nominations. At this time, I would like to ask for the confirmation vote on these officers and board members. Sarah, can we proceed even though, okay, we'll just, one momento, everybody, to ensure that we are in a legal capacity operating. There we go. All right, I'll give you just 15 seconds to view the names of our slate for 2023 board members and officers. And now I'd like to ask for the confirmation vote on these officers and board members. All in favor, please say aye. Any opposers, say the same. Thank you, board. With our business complete, I hereby close the 2022 annual meeting of the Douglas County Chamber. Thank you so much. All right, a big thank you certainly to our sponsors, Georgia Power, Georgia Douglas Public Health, for partnering with us to inform our community about the great things that are happening in regards to healthcare in Douglas. We sincerely appreciate all of your support. Thanks again to Greystone Power for being the naming sponsor. Now I'm going to ask that Trevor and Lisa would please come and help us draw for our door prizes, and then we will have our dismissal. Thank you. We have some interesting gifts today. Everybody should totally be excited and delighted. And those of you who have been here before, if I call your number, I need you to be excited for the free gift you are receiving. All right? Let's not be a silent winner. All right?
Ready?
All right. What we got, Lisa? I'm going to call the last 4 digits. 3, 1, 8. 3183. Yay! Woohoo! Yes, that was great. Steve's got it. It's a perfect day. A nice, soft, cozy blanket. Yes. You do? You got?
Oh, no, she can draw.
Okay.
You can do it.
Okay. All right. Last four digits again. 3157. 3157. Going once. Going. Sam? That's you, baby? Shh. Sam Davis did not win today, all right? That's great.
All right, last one from Public Health.
All right, last one from Public Health. 3159. 3159. Come on. Going once, going twice. Yeah. Oh, okay. Thank you, Shan. Oh, shout out to Shan for the re-gift. Woohoo! POS Solutions in the house. All right.
They have money at POS.
They will manage your assets at POS Solutions. All right, the last four digits, 3163. Yes, Frank! Woohoo! All right, now you got gift cards. What's your gift cards? How much?
I don't know.
You're supposed to know that.
These are restaurants.
Oh, all right. Now we're drawing prizes for gift cards to our local restaurants. So the last four digits for this winner is 3193. Yay! She looked like she was about to jump up. She wanted to jump up out the chair, but she was like, wait. Excellent. Yes, I like that. Congratulations. All right, what we got, Trevor?
To the very bottom.
Trevor went all the way to the bottom. All right, last four digits, 3187. 3187. All right. All right, taking it off the top. This is the last gift card. So who's taking me to lunch? 3217. Yay! Congratulations to all of you. Thank you again to our sponsors. So appreciative. Thank you so much for our door prizes. And I hope each of you have an amazing Wednesday. Be blessed. You are dismissed.